or before we start, as you see النوتبوكس اللي عندكم تقدروا تكتبون عليها أسئلة، لأن after me and are done with our talk بعد ما نخلص راح نقدر نسأل all the people from Harvard Medical School basically any question you want. So we have an amazing team. We have a child mental health specialist, a women's mental health specialist, a depression specialist, primary care and integration, mind and body medicine, and schizophrenia and global psychiatry. So I can guarantee that there's not one question you can ask them that they won't be able to answer, or else I've given you that challenge. So. Thank you, Dr. Herman. Very kind introduction. So Daran and I have an advocacy with family, and one of the ways that we try to eradicate stigma is to empower individuals of the public life themselves to have the correct information about what is mental health, what are the treatments, and tomorrow, which is the second part, we're going to tell you more about mental health. But one of the ways that our personally try to do this is to tell you what the media has told you that is incorrect and what the media has told you that is correct. So please excuse me that I was talking to Arabic and English because, as you know, we're about a bilingual campaign, and it might seem redundant because a lot of you are bilingual, but I assure you it's enjoyable. So راح ابتدي بالعربي. أول ما أنا بدينا بشغل علم النفس كان وايد ناس يقولون لنا ليش تخصصوا في الاختصاص راح تصيروا الميانين أو اللي تشتغلون معهم يعني، بس اللي ما يدركونه معظم الناس هو أن الأمراض النفسية مو اللي تبينها التلفزيون. معظم الأمراض النفسية عادة تكون اكتئاب أو قلق وشيء نقدر نعالجه بسهولة. أول شيء في شيء اسمه وصمة العار اللي هي نظرة المجتمع حق المريض النفسي. للأسف المجتمع عادة يشوف المريض النفسي كإنسان غير عن الحالة. فأنا شو نحاول نقول إن رحنا في الريسيرش اكتشفنا شنو سبب وصمة العار، إيش معنى المرض النفسي اللي احنا نشوفه كغير عن الأمراض الثانية. أول شيء هو يجي من عدم المعرفة. للأسف بعض الناس يشوفون المرض النفسي اللي يورينا التلفزيون، ما يقولون أمراض نفسية نفس مرض الاكتئاب أو قلق. وأنا I assure you إن بعضكم يعرفون أحد عنده مرض نفسي بس probably ما راح يقول لكم. للأسف لما احنا نخاف من الناس اللي عندهم أمراض نفسية نبتعد عنهم ونقول they need their space، وهذا شيء وايد غلط لأن it causes a separation بينه وبين اللي عندهم أمراض نفسية. فلما نكتشف شنو هي الأمراض النفسية is when we can نكسر هذا حاجز الخوف. Also راح تعلمونا باكر إن أنتم كناس من المجتمع ممكن تقضون على وصمة العار، تتكلمون عن الأمراض النفسية أكثر، تكتشفون شنو هي الأمراض النفسية اللي بالمجتمع وإن تسعون للعلاج. So my sister and I are extremely interested in stigma, and through our research we realized that one of the main causes of stigma is actually the lack of knowledge. And one of the things that we try to do is to empower the public with the knowledge of what is mental health, what are basic treatments of mental health, and to take off that image of the psychotic patient and go towards more common mental disorders such as depression and anxiety. And we try to teach the public, as will be a talk tomorrow by Dr. Anais and Mbawa, that you yourself can play a role in eradicating stigma of mental health. So I'm going to play with you a little game, okay? It's called Myths versus Facts. And I'm going to test with you guys if you can tell the difference between what is a myth and what is a fact. راح نلعب معكم لعبة صغيرة ونشوف إذا أنتم تعرفون شنو حقيقة المرض النفسي وشنو هو مو صنع الأمراض النفسية. Let's start. Okay, let's see the first statement. The first statement says, I am worried that my children will inherit my mental illness. أنا خاف من عيالي راح يورثون مرض نفسي. Who thinks this is a myth? Who thinks this is not true? And you have to participate or you'll be asked to step out. that your kids will inherit your mental illness. Okay, who thinks this is not true? Okay, actually, it's a myth. And let's see why. First of all, because you cannot just say that your children will inherit your mental illness. It is much more complicated than just you as parents having mental illness and your children having mental illness. And this is one of the fears that the public tends to have. And what we say is you cannot tell who can have a mental illness. It's prevalent, but we cannot tell who it is. Because getting a mental illness is not only about the genetics. There's a genetic factor, but there's also a psychological factor, and there's an environmental factor. So usually I would give this example, and I say, there's this person that has a gene, let's say he's at risk for depression, and a person doesn't have a gene that's at risk for depression. And Dr. Mustafa was a specialty of depression. And so I say, let's imagine a person who has a genetic risk, grows up in a very, very highly supportive environment, has great experience as a child, and goes, normally through life. Could have depression, could not have depression. And then we'll have the person who's not at risk for depression. Experiences maybe sexual abuse, physical abuse, highly stressful environment, maybe loses a parent. Who thinks the genetic versus the environment is going to get the depression? Who thinks it's all about the genes now? As you can see, the environment has a huge effect. I'm going to say in Arabic. الأمراض النفسية مو بسهولة نقول إنها عامل وراثي. ما نقدر نعرف منو يصير في الأمراض النفسية. في عامل وراثي، بس الإنسان اللي يصير في المرض النفسي يكون عامل بيئي، عامل سيكولوجي أو نفسي، وعامل وراثي. فالإنسان يكون عنده مثل ضغط للأمراض النفسية، بس إذا ربى بيت يكون أهله مسلمين فيه، ما صارت فيه أي مشاكل قوية أو ضغوط نفسية كبيرة، ما تصير فيه الأمراض النفسية. ولكن الشخص يكون ما عنده أي ضغط للأمراض النفسية، ولكن كان البيت مثلا ينصب أو كان البيت في ضغوط نفسية أو صارت له مشكلة في حياته، وممكن تصير فيه أمراض نفسية أكثر. ف it's not as easy as your children are going to get their mental illness. So don't worry. Actually, my brother-in-law told me a very cool story. He said that before people used to cover their head, thinking that mental illnesses can transfer from one person to the other. So, let's see, is he right? Who thinks mental illnesses are contagious? من يقول لنا الأمراض النفسية معدية؟ إذا نحن بعض. Okay, who doesn't think that mental illnesses are contagious? Okay, it's a myth. Not true. Mental illnesses are not contagious. Mental illnesses, as I said, have a biological, psychological, genetic, and social factor. However, they're not viral or bacterial. So you hanging out with your friend who has a mental illness does not mean that you get their mental illness. And this is an extremely important point, because actually social support, which is being there for someone with a mental illness, actually is a huge predictor in the person recovering. So no need to cover your head. الأمراض النفسية مو معدية. الأمراض النفسية نقولها عامل بيولوجي، بيئي، نفسي. فإذا أنت قعدت مع الفيزيكال، قعدت مع الفيزيكال اللي عندها مرض نفسي، ما راح يعدونك أورينتك، لأن المرض النفسي ما له بكتيريا ولا فيروس راح يصير فيكم. ووايد مهم إن احنا نكون هناك اللي عندهم أمراض نفسية، لأن إذا كان المريض النفسي عنده ناس معاه قاعد يقربونه بحثها للشفاء، chances are راح يتشافى أسرع من اللي ما عنده أي أحد. I mean تخيلوا إذا أنت وايد مكتئب وكل ربعك فجأة هدوء. Okay. So this is a great example of social support and the difference that you make. This is the actress Glenn Close, and her sister has bipolar disorder, and she didn't leave her sister. She didn't run away because she battled some contagious disease. She supported her, and they actually have a really great anti-stigma campaign called Bring Change to Mind. It's based in the United States. Alright, let's do the next. This is a favorite one. This is probably the strongest myth in, people with mental illness are violent and are a danger to society. They scare people. اللي عندهم أمراض نفسية هم خطر على المجتمع ويخربون. Or ممكن إذا يعمل مريض نفسي ممكن الكافي أو الجمعي. Who thinks this is true? Who thinks this is a myth? Okay, it is a myth. Actually, here's an interesting fact. People with mental illness are more likely to be victims of violence than perpetrators of violence. As you know, in general, people who are at risk for violence tend to be the vulnerable people, such as children, animals, which is horrible, and people who cannot, stand up for themselves. So people with mental illness tend to be more victims of violence than perpetrators of violence. And in addition, there was research that controlled for a lot of demographics and saw that the incidence or the chances of a person with mental illness being dangerous is the same chance as the normal population in society. So there isn't, and as you doctors would support me, there isn't some criteria that says, what symptom smacks people or kills people. It's not a symptom. المريض النفسي actually مو خطر على المجتمع. وكان في وايد أبحاث شافت إذا المريض النفسي هل هو خطر على المجتمع أو لا. واكتشفت الأبحاث إنه ما في فرق بين إذا خلينا نتأمل الناس عندهم أمراض نفسية وناس من المجتمع. المريض النفسي عادة يكون اللي الناس يصيرون عادي معانا، مثل ما نعرف الأطفال أو اللي ما يقدرون يدافعون عن نفسهم، هم أكثر شيء اللي يصير العنف ضدهم، هم اللي يتفقون يعني. في pattern trade بالجملة. So the next question is, treatment doesn't work. Once a person is affected with mental illness, they will never recover. فدائما العلاج بالمريض النفسي يبقى دائما مريض نفسي. يعني do you believe إن أول ما أحد يصير فيه مرض نفسي خلاص يظل مريض نفسي؟ Okay. Who here thinks this is true? I think they got the pattern. Who here thinks it's not true? Good. Increasing the agreement rate. Okay. So this is not true. Okay. So I'm going to start with this. So treatment does work. Most mental illnesses, they're not recoverable, but they're highly treatable and they're highly manageable. There are many diverse treatment and medication options, and basically each patient can find one that fits for them. And with every passing day, research is going to increase the success rate of treatment. So basically, what we'd like to encourage is I always tell people, you'll never go to treatment and be worse than when you started off. It will always be better. So treatment always works. أكثر الأمراض النفسية يمكن إن تعالج إلى حد ما أو يمكن إن الناس يقدرون يقدرون إن يسيطرون عليها فعشان ما تزيد. وطبعا قاعد يزيد عدد الأبحاث الناجحة وقاعد يرتفع عدد معدل النجاح للعلاج النفسي. So I always like to use this image, which is the way media portrays someone in a psychiatric unit or someone in treatment, someone shackled or is in a bed or sedated. I like to say that this is the face of someone in treatment. They're happy, they're satisfied, and they're leading a better life. فأنا أقول إن هذا وجه الإنسان اللي بالعلاج النفسي. يعني وايد عندنا احنا صورة وايد سيئة عن المرض النفسي، نشوف انه هو انسان كله بالمستشفى، انسان توقفت حياته، انسان ما يشتغل، انسان ما يدرس، بس اللي ما نسمع انه هو chances are حياة نفسية أكثر من إنسان في مرض نفسي من عدة أمراض نفسية، أيضا الاكتئاب ولا التوتر ولا القلق ولا الانفصام، ويقدرون يعيشون حياة طبيعية. اوكي بالكويت اللي يقولون هذا الكويت احنا ما عندنا مشاكل. This is, I believe, one of the ways stigma is very, very abundant in our society. People believe that mental illnesses or mental health problems are rare. المشاكل الصحية النفسية والأمراض النفسية شيء نادر. You want to vote? You want to vote. So who here thinks this is true? That they are right, that we live in a good society and we will not face these problems. Okay, who thinks this is wrong? Okay. Okay. So 1 in 4 people will be affected by mental illness at some point of their life. So people with mental illness, the reason you don't usually see, so if I'm saying 1 in 4 people have mental illness, you're thinking, well, there's a fourth of the audience that have mental illness. But the reason you don't see these people is because they're forced into silence, which is something you learn about if you come back tomorrow. And they're forced to hide their illnesses, they're forced to not talk about them. So the only reason you don't see in a society like us so much mental illnesses is because people choose to not talk about them, or they're not encouraged to talk about them. However, chances are you probably do know someone with mental illness. According to NAMI, mental illnesses are more common than cancer, diabetes, or heart disease. So بيتأثر واحد من كل 4 أشخاص، يعني في واحد من كل 4 according to research يقولون إن الواحد من كل 4 أشخاص يكون عنده مرض نفسي في فترة من حياته أو مشكلة نفسية في فترة من حياته. والسبب اللي احنا ما نشوف هذا بالمجتمع لأن الناس لما يصير عنده مرض نفسي أولا إن يقولون لهم انطر شوية ما تدري يمكن تتغير، وايد يصير عندهم ضغط إن لا تكثر انطر، لا تكثر إن عندك مشكلة نفسية، لا يكثر إن عندك مرض نفسي. وهذه من المشاكل اللي نشوفها إن ما يوصل المريض النفسي حق المستشفى ولا العيادة إلا اللي احنا نسميه الستيجز المتأخرة، لأن أهله ولا فريندز ما لقوا سبورت، ما لقوا منهم الدعم إنه يتعالج في بداية المرض. I think this was one of the scales that Dr. Herman, which is that mental illnesses. If I admit that I have a mental illness, it means I'm weak. If I would try harder, I would have had a mental illness. أنا معترف بأنني مريض نفسي، يعني إني ضعيف، لو بدأت مجهود أكثر معناته ما يكون عندي مرض نفسي. كل ما يكون عبالة إن المرض النفسي كانت غلطتي. في ناس يقولون ممكن عليك بربع ولا لو حاول زيادة مو المفروض، يعني وايد يشوفون بالذات على الصغار يعني يقولون لهم سناب عارفت مو هذه مشكلة فترة وتعدي مو صدق عندك مرض نفسي. ف this is, are we going to do it again? You're going to answer? Is it true? صح ولا غلط؟ إن إذا أنت عندك مرض نفسي معناته أنت ضعيف. Raise your hand. Okay, who thinks it's not true? Okay, good. That's not true. I think you would be very smart if by this point you realize that there is a pattern. Okay, so a mental illness is not a sign of weakness because the person is not at fault for developing it. So usually a mental illness is as you said, a combination of biological, psychological, and environmental factors. But a mental illness doesn't go away with forgetting about it or getting the willpower to fight it. Treatment is always needed. It's good to have the enthusiasm, but not if you're trying to not admit that you have mental illness. فالمرض النفسي ليس دليلا على ضعف، يعني إذا أنت اعترفت أن أنت عندك مرض نفسي مو معناته أنك تسوي شيء غلط ولا أن أنت ما بذلت جهدك، ولو أنت بذلت جهدك ما كان حتى عندك مرض نفسي. لأن المرض النفسي مثل ما قال دكتور عادل في بداية الندوة إن المرض النفسي له عوامل وايد، له عوامل بيولوجية، له عوامل سيكولوجية، له عوامل نفسية وبيئية. فالمرض النفسي ما يختفي مع قوة الإرادة ولا يختفي مع، يعني في ناس يقولون انسى عن الموضوع اطلع اروح شاليه يعني فترة وتعدي، فهو ما يروح مع قوة الإرادة even though it helps إنه يكون عند الإنسان قوة الإرادة، بس ما يروح المرض النفسي إلا بالعلاج. Okay, هذه I'm going to point out my sister who asked this question. She's in the back table. And so she asked me if mental illnesses and mental retardation are the same thing. And كانت تسألني أختي إذا المريض النفسي مثل المختل عقليا. Who cares if it's true? You have to raise your hand. She's not true. Who here thinks it's wrong? I'll answer. Okay, so this is definitely wrong. Mental illnesses and mental retardation are two separate and different conditions. A mental illness is a condition that causes considerable changes to a person's thinking, feelings, mood, behavior, and perception, whereas mental retardation is an impairment in normal development. So unlike people with mental retardation, who are usually below average intelligence due to their condition, people with mental illness have diverse intelligence levels like everyone else. This is just I'm giving you the two definitions of them, but they're seriously two separate conditions. But people, due to stigma and due to lack of knowledge and due to media, basically, they think these are the same thing. So المرض النفسي والتخلف العقلي حالتين مختلفتين ومنفصلين. المرض النفسي حالة تغيرات كبيرة بفكر الشخص، مشاعره، مزاج، السلوك والإدراك، القدرة، والتخلف العقلي هو تخلف النمو الطبيعي، القدرات الفكرية والتعلم وأساليب التعامل. Okay, Dr. Asha. Mental illnesses only affect adults. They don't affect children and teenagers. This is actually, we've been asked this a few times. People think that children are either going through a phase or they can snap out of it. They think that mental illnesses can only happen to adults, not children. الأمراض النفسية تصيب الكبار فقط ولا تصيب الأطفال والمراهقين. I'm going to answer this question for you. So that's wrong. هذا خطأ. مشاكل الصحة النفسية تصيب الأطفال والمراهقين. It's simple. I think يعني data supports this إن المشاكل الصحية تصيب الأطفال والمراهقين. So okay. To conclude. Okay. So a lot of you saw a pattern of myths coming up, and one of these things is that we were trying to make it very clear that the most common knowledge about mental illness is actually quite incorrect knowledge. And so here are our recommendations. Okay, I'm going to say it in English. أول شيء خلينا نقول إن كيف يشوفون الأخطاء هو مو صدفة إن كل أخطاء، لأن معظم الناس اللي يعرفون عن الأمراض النفسية كلها أخطاء، وهذا سبب إن التلفزيون تحط الأشياء اللي يعني راح تجذب ناس أكثر، اللي هو مو صدقي نفس المكتئب أو الغرض. ف these are my recommendations. First of all, be aware that the media tends to distort people with mental illness. It sells more. It's more interesting than saying someone has depression, goes into treatment, feels better, gets married, and lives happily ever after. It doesn't sound too really. The second thing, educate yourself and get your information from reliable sources. The TV is not a reliable source. There's the internet, check the site. Wikipedia could be reliable, not that reliable according to our researcher. But get it from reliable sources. If your friend tells you that she thinks mental illnesses are contagious, question it. Don't assume she's correct. Educate yourself. Empower yourself with your knowledge, because one day, if you ever have a mental problem or know someone with a mental problem, trust me, you will want to know the correct information. It can make a huge difference. Third thing, and this is what Dr. Naim will, first of all, another recommendation has come from. Dr. Naim will talk about this, and as I said, supporting people with mental illness makes a huge difference in recovery. If someone has depression or anxiety and has their family or has their partner or has their friends support them, it does make a huge difference. And we'll learn more about this with Dr. Naim And also, we'll tell you tomorrow, and this is Dalal and I said tomorrow, you actually can do stuff to end the stigma of mental health. A lot of stuff, very clear steps in which we as a community, as a society, can end the stigma of mental health. And I think it was more clear in the professional forum today in the morning. We have services available, and thanks to the stigma and the fact that people don't want to talk about the fact that they have mental illness, you have readily available treatment and no one is going to it. And we have to change this. This is our obligation as a society to change this. And okay, أول شيء إن قلت قبل إن وسائل الإعلام تشوه صورة المريض النفسي، فلازم لما تقارنون التلفزيون تعرفون إن المريض النفسي شكله في التلفزيون مو شكله بالصوت. ثاني شيء إن لازم لما تاخذون معلومات عن أمراض نفسية ما تسمعون من فيديوكم ولا من الراديو، لازم تكون من مصدر موثوق، عادة مثل دكتور نفسي أو أحد يعرف عن أمراض نفسية. وثالث شيء إذا عنده مرض نفسي، وهذا حكينا عنه الدكتورات مطوع باكر، احنا كاخوان او اخوات او امهات او ابهات حق اللي عندهم امراض نفسيه ممكن نسوي فرق بالعلاج. لما المريض نفسه يروح حق الدكتور بروحه غير لما المريض النفسي يروح حق الدكتور، طبعا confidential، بس لين يرد ويشوف ان عائلته دعمته يبونه يسال العلاج نفس لو كان عنده اي مرض ثاني. واخر شيء اللي هو انا بتكلم عنه باكر، في very clear steps شلون انك كواحد من المجتمع ممكن دكتور نفسي او طبيب نفسي ممكن انك تساعد اللي عندهم امراض نفسيه. Thank you. As we promised, so Diana used to do this much lower scale than this. We used to get a lot of questions, and because Diana and I are not as we know, Diana and I are not clinicians, and so we can't answer a lot of questions such as what are symptoms of depression or what do I do if my child has a learning disorder. And so we got pretty much the best of the best doctors from Massachusetts General Hospital and Harvard Medical School, and we already have a lot of questions. Okay, the first question says, in wartime, how can we provide help for psychiatric patients? Any real stories help us or to calm us down? You know, what can you
Okay, so you've given me an easy question. Thank you. So, first off, let's hope there's no more wartime. Let's not have wars. That's the best way to help people with mental illness. What happens in the context where there is a conflict or war, the people with mental illness are, of course, they are already a vulnerable population, but they become an extremely vulnerable population. In particular, the systems that actually have taken care of them may actually break down. And so one of the things that we try to do during such an event is to pull together and piece together a system that continues to support them, make sure they get their medication, helps them deal with the stress and trauma, because it simply can make whatever they already have, it can make it worse. So it's really trying to pull the resources to continue to provide the support that the family and the treatment program is already providing, because it can be disruptive.
Okay. This question is. The question reads, define stress. How could a thought change your brain structure? One thought could affect two persons differently. How could you explain this? Is it perception? And what is perception? That's 5 for the price of 1. Well, okay, Dr. Herman suggested to us very good ideas about what stress is. The human being is exquisitely engineered to perceive separation threats. get your body to do what it needs to do to keep you safe. This is tremendously important. And when you are acutely threatened, if you're mugged at the ATM, for example, this is the most blessed thing that ever happened to you. Because it will give you the best chance possible of staying alive. But think about it, if this trigger is triggered all the time, if you feel stress all the time, think about the energy it takes for your body to deal with that constant stress. This is what happens, just to bridge on to the earlier question, this is what happens to poor people who have post-traumatic stress disorder. Their amygdala are on a trick, their trigger is set so low that they are engaging their stress response fairly often. So when, I think yesterday, or earlier today, it was mentioned about the siren, I think they mentioned that. That is going to trigger the stress response, and that person is going to be exhausted by trying to deal with the hormones and transmitters that are flowing through their body. And that's what will essentially lead to post-traumatic stress disorder. Now, the other question is, how does the thought change the brain structure? Well, we at Massachusetts General believe that thinking is a biological event. So the way we are created allows us to transmute or change thoughts into biological events, biochemical events, neuronal activity, synaptic changes. So yes, indeed, thinking will result in a change in brain structure. Our colleagues in neurology decades ago realized this when they were studying patients who had epilepsy. And they would put electrodes into those patients because they were trying to study where the irritable focus was, and they were going to scoop it out. But they learned that if they ignited a certain cell in the brain, the patient might have a hallucination, or might have a certain perception, a taste, or hear a sound. So this leads to an answer to the question below about what is perception. Perception, thought, and brain activity are inextricably linked. Now, I would be kidding if I told you that we understand conscious thinking fully, completely. Much smarter people than I are trying to wrestle with that question about what consciousness really is. But in any event, we feel as biologists of the brain, as neuroscientists, that when you think, you are changing your brain's biological activity. And of course, we're all different. We have many similarities. So one thought can certainly affect two persons differently. And it can lead to different biological, the same thought or the same visual perception can be processed biologically differently in two different brains. It may be very meaningful to you to have a symbol of Ramadan perceived because it is your childhood, it is your belief. For me, that's not going to cause the same biological change in my brain. So, anyway.
So the next question is for me. It's what's the best way to deal with eating disorders? Please help. That's a tough question. Eating disorders are a very, very tough area in psychiatry to treat. One thing you don't do is tell patients you must eat, because telling them to eat and not understanding the psychology behind why eating is effective is not productive. Some of the best treatments for an eating disorder is number one, therapy, trying to understand, number one, the meaning of it. Number two, also educating the patient about the medical complications that can occur if an eating disorder continues. And, actually talking about the medical complications in some ways
helps the patient really understand the physiological changes and the harm that they are doing to their body without being judgmental. Medications have had, very minimal effect, but it's really supportive therapy, understanding the psychology behind it, monitoring the medical side effects, and depending on the particular person, and if we're talking about anorexia in particular, having family involvement is very important, because sometimes there's also a dynamic that plays in the family that precipitates the eating disorder. But it is eating disorders in general are very complicated, and they are long-term disorders that require long-term treatment. You can have episodes in which they can remit, but stress or other triggers can reinitiate eating disorder.
Okay, so how can you convince someone to stop coping with depression through bad means, alcohol, drugs, smoking, and to switch to good means, meditation, sports, etc.? It's a great question because one of the things that depression does, it changes people's behavior. It makes you shy away from things that are helpful, and it makes you switch to things that have a kind of a negative trickle-down effect. So, so even though there are now good data to show that physical exercise helps depression, that meditation helps depression, when you look at how often people with depression practice those things, they actually do it less when they're depressed. And it's very hard for them to find the motivation to do it. We know, for example, that alcohol is depressogenic. In fact, a classic study by Schucke has shown that people who have kind of self-medicate with depression, the moment they stop drinking, depression improves significantly. But it's very hard to stop drinking when you're depressed. In fact, Dr. Pratt was mentioning eating disorders. 50% of women with eating disorders have depression. And when you look at 5 or 10 years follow-up, most of the people with eating disorders, whether anorexia or bulimia, will end up having depression as their main diagnosis and not the eating disorder. So one could argue that eating disorders are a way of self-medicating, if you wish, a depression for many women. So how do you get people to stop starving or overeating or drinking when in fact these things are kind of bad approaches to self-medication? I think that what you guys are talking about, education, is critical. Having people realize that this means of coping with depression are actually self-defeating, that making things worse is critical, and not kind of minimizing the impact of these things.
As a university student, other than referring my colleague to a counselor, how can I help him or her in regards to major depression? That's a great question. So you don't have to be a university student to be put into this situation. But I actually I had worked at MIT, Massachusetts Institute of Technology in Boston for about 10 years, or Cambridge. And so I got to see a lot of students, and also to understand all of the barriers that are in place for them to prevent them from coming in. But I did find that the best method by which they would actually come in and finally see someone was their peers, the peer pressure of a friend who was concerned about them and continued to be concerned and express their concern, provide information that would lead them to eventually come in and see someone. I think whether this is a student in college, or a researcher, you can student in college, a family member, it's the same issue about being supportive, being there for them, listening, but also guiding them along the way, and to the point where they actually are willing to see someone, encouraging their healthy behaviors. If they are runners and they like to exercise, try to go running with them, try to get them back to those things that are actually quite healthy, and so on. Then they turn the corner and be willing to get help and so on. But it's really the same story, with trying to get a loved one, someone you care about, into treatment. There are challenges, but certainly there are successes. Richard, you want to comment as well?
Our group every year goes out to colleges in the Boston area, and we do screening for depression in college students. And the reality is that usually 1 in 7 college students at any given time will be depressed or will have thoughts of suicide. And I often tell parents that say, you think that depression is rare, you don't think that it should be screened for, but 1 in 7 college students will have depression. So screening for depression, raising awareness, and then dealing with depression as hypertension, or people don't question screening for diabetes or screening for hypertension. So why shouldn't we do the same thing with depression?
Oh yeah, I've got two. I'm going to take two because this one is easy. I'll take one really easy one. Can marijuana cure mental disorders? Should we ask for a whole change of hands here? I think. Right. So I'll let you do that the next time you do it. So the other one is a little more. These are, by the way. So I'm going through these. I've done this for many, many years, where I gather questions from the audience and distribute. These are fantastic questions. I mean, sort of heart-moving questions that you're asking to have the opportunity to keep going. So we're going to do as many as we can. We'll maybe about 15 more minutes or so. We'll do as many as we can. And then we're going to try and incorporate some of these, and specifically to ask them to be addressed by our speakers tomorrow. So we'll integrate this terrific information so that we can tell everybody and integrate it into our talk. So this question is, how do you stop illness from spreading in the family genetically in terms of upcoming generations? I can't change genetics. So, well, that's what I was talking about a bit in terms of this new notion of epigenetics.